Welcome to the quick guide on how to use your Saxenda pen. The Saxenda pen quick guide is based on the instructions for use in the Saxenda medication guide. Please read the instructions for use in the Saxenda medication guide carefully before using your pen. Do not use your pen without proper training from your healthcare provider. Make sure that you know how to give yourself an injection with a pen before you start your treatment. Check the Saxenda pen. Check the name and the colored label of your pen to make sure that it is your Saxenda pen. Pull the pen cap straight off. Check that Saxenda in the pen is clear and colorless. Attach a new needle. Take a new needle and pull off the paper tab. Push the needle straight onto the pen and turn it until it is tight. And then pull off both needle caps. Keep the outer needle cap. Check the Saxenda flow with each new pen. Check the Saxenda flow before the first injection with each new pen. Turn the dose selector to select the flow check symbol. Hold the pen with the needle pointing up. Then press and hold the dose button until the dose counter returns to 0. The 0 must line up with the dose pointer. Make sure that a drop appears at the needle tip. If no drop appears, repeat the step up to 6 times. If there's still no drop, change the needle and repeat the step once more. If a drop of Saxenda still does not appear, do not use the pen. Contact Novo Nordisk. Always make sure that a drop appears at the needle tip before you use a new pen for the first time. Select the dose. Turn the dose selector to select the dose you need to inject. Do not set the dose by counting the number of clicks you hear. Inject the dose. Make sure you can see the dose counter. Do not cover it with your fingers. This could stop the injection. Insert the needle into the skin as your healthcare provider has shown you. Then press and hold the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. Keep the needle in the skin and count slowly to 6 to make sure the full dose is delivered. 1, 2, 3, 4, 5, 6. Then remove the needle from the skin. Remove the needle. Carefully remove the needle from the pen. Do not put the needle caps back on the needle to avoid needle sticks. Dispose of it in a sharps container. Always remove the needle from your pen. This prevents contamination, infection, leakage of Saxenda, and blocked needles leading to inaccurate dosing. Put the pen cap back on. You've now learned how to inject with a Saxenda pen.